Before we do anything else today, we are going to take a very simple test. In the next 30 seconds, you will get a clear snapshot of how well blood is circulating in your legs right now. No equipment, no standing, no special clothing, just honest answers. If you are over 60 and your legs ever feel heavy, tired, swollen, or cold, this matters more than you think. You are starting with a perfect score of 5 points. I'm going to describe 5 common symptoms. For each one that applies to you, subtract 1 point. At the end, you will know exactly where you stand. Make sure to watch until the end because the number 1 exercise activates what cardiologists often call your second heart, and most seniors are not using it correctly. Let's begin. You start with 5 points. Number 1. Do your feet or toes feel cold even when the room is warm? If yes, subtract 1 point. Cold feet often mean blood is struggling to complete the full journey down and back from your toes. Number 2. Do your legs feel heavy or unusually tired by the end of a normal day? Not after a long hike, just after sitting, light chores, or regular activity. If yes, subtract 1 point. That heaviness is often blood and fluid pooling in the lower legs because the return flow has slowed. Number 3. Do you notice swelling around your ankles in the evening? Maybe your socks leave deep marks or your shoes feel tighter at night than in the morning. If yes, subtract 1 point. Number 4. Do you get calf cramps at night that wake you up suddenly? If yes, subtract 1 more point. Cramps often occur when muscles are not receiving consistent oxygen supply, and oxygen travels in your blood. Number 5. Have you developed spider veins or varicose veins that were not there a few years ago? If yes, subtract your final point. Now, look at your score. If you scored 5, your circulation is strong. These exercises will help keep it that way. If you scored 3 or 4, your body is sending early signals. This is the perfect time to act. If you scored 2 or lower, do not feel discouraged. Be encouraged. Circulation responds quickly to movement, and improvement can happen faster than you expect. Pause and remember your score. We will come back to it. Why this happens. Before we jump into the exercises, here's what's happening inside your legs. Your heart pushes blood down to your legs easily. Gravity helps with that. The difficult part is getting blood back up toward your heart. Inside your leg veins are tiny one-way valves. Their job is to stop blood from falling backward. When you are young and active, those valves are strong and your leg muscles contract often, helping push blood upward. As we age, 2 things change. First, we sit more. Long periods in chairs or cars mean your leg muscles stay inactive for hours. Second, the valves inside your veins can weaken. When that happens, blood begins to pool in the lower legs. That pooling causes swelling, heaviness, visible veins, and sometimes night cramps. Here's the key. The only force that actively pushes blood upward against gravity is muscle contraction. Every time your calf or thigh muscle tightens, it squeezes the veins and pushes blood upward. When you sit still, the pump slows. When you move with intention, the pump restarts. Even short bursts of movement can restore blood flow. Exercise number 3, seated march. Sit in a sturdy chair, feet flat on the floor, back tall but relaxed. Lift your right knee a few inches, then lower it slowly. Lift your left knee, then lower it. You are marching in place while seated. 2 important details. Lift with intention. Do not swing your leg. Lower slowly and quietly. Move at a steady rhythm, about 1 lift per second. Do this for 60 seconds. You may feel warmth in your thighs. That's fresh blood reaching your muscles. Exercise number 2, leg extension with toe point. From the same seated position, straighten your right leg comfortably. Point your toes away from you and hold for 2 seconds. Then pull your toes back toward your shin. Slowly lower your leg. Repeat on the left side. Do 10 repetitions per leg. This movement activates both the thigh and calf pump, improving circulation from ankle to hip. Exercise number 1, calf pump reset. This is the most important exercise. Stay seated with feet flat on the floor. Lift both heels while keeping your toes planted. Hold for 2 seconds. Slowly lower your heels. Repeat 15 times. Rest briefly, then complete up to 3 sets. Focus on strong, controlled movement. The stronger the contraction, the more effective the pump. You may feel warmth in your calves and feet. That's improved circulation. Daily circulation boosters. Number 1. The 20 to 30 minute rule. Every 20 to 30 minutes of sitting, activate your calves for at least 20 seconds. Number 2. Ankle circles before bed. Rotate each ankle slowly, 10 times in each direction. Number 3. Leg elevation. Rest with your legs slightly elevated for 5 to 10 minutes to help blood return upward. Final thoughts. Remember your starting score. Practice these exercises once or twice daily for 2 weeks, then test yourself again. Many people notice less swelling, fewer cramps, and lighter legs. Circulation is not fixed. It responds to movement. This is not about intense workouts. It's about consistent, intentional movement. Your legs have carried you for decades. They deserve daily care. If this helped you, share it with someone who struggles with heavy or tired legs. Stay strong, stay moving, and I will see you in the next one.